Hello, Ron Marsh. Can I help you?
The Scottish Diabetes Buddy Service is provided by your local health board and is staffed by specially trained patients who themselves live with diabetes. Kate Michi, National Coordinator for the service, explains.
Having lived with diabetes for the past 36 years, I feel I have a fair experience in living and coping with diabetes in daily life. At diagnosis, I was admitted to hospital, where I learned about all things to do with diabetes: injections, urine testing, what to eat, and more importantly maybe what not to eat, how important it was not to miss out on medication, and of course the serious complications of the illness. Now that was 1970 and I was 11 years old. However, today most people are only admitted if they are ill or have ketoacidosis, as can happen in childhood. Diabetes is quite a complex illness, and in order to manage it well, you need to become your own expert in living with it. So where do we get the information and the knowledge that we need? Healthcare teams, books, DVDs and the internet? But what about the people who live with diabetes themselves? They can be a fantastic resource for you. The Scottish Diabetes Buddy Service is a friendly support service run by specially trained patients like myself who live with the condition and have probably been there, done that, and got the t-shirt as well in many instances. It is a really friendly, confidential, non-medical support service. It is very easy to access, and that can be of great value to patients of both type 1 and type 2 diabetes. This can be of great help, especially close to diagnosis, and is useful to be able to talk to someone with similar experiences, to glean hints and tips, encouragement and increased confidence in understanding diabetes. Patients can have access to someone who understands their difficulties and fears.
How did you manage to have enough courage to do it the first time?
Well, as I say, the nurse who put me onto the insulin was most cooperative and helpful to me.
Feedback from Scottish Buddies is that many people welcome input from others who have diabetes and are reassured from someone who has the same condition to have good, sound advice. I would encourage you to get in touch. We are here to help you.
As a buddy, I can tell you, from my point of view, I'm happy with what they're doing with me. And I feel that my diabetes is very much better controlled now than it was when I was taking tablets.
The Scottish Buddy Service is available by phone, letter or face-to-face contact. You can phone the following numbers. Grampian on 01 224 55 5379. Lothian on 0131 537 3257. Tayside on 07770 882408. Fife on 01592 226842, and Glasgow on 0141 201 4473. Or write to the Scottish Diabetes Buddy Service, care of Grampian Diabetes MCN, Woolman Hill Hospital, Aberdeen, Scotland, AB 251LD.